pregnant women and children under 5.
Okay, and the statistics speak for themselves, because in Kenya, the latest show that malaria is the leading cause of death of children between the ages of 5 to 9. So it's definitely a cause of concern. That concerted effort approach is needed as well. Talk to us about the strategic intervention so far implemented to ensure the progress to near elimination. In short, what's Kenya's current commitment in the fight to end malaria?
Wow, there's been lots of great political will with our President Ruto getting fitted just sometime last year for the steps and strides the government has taken in fighting malaria. I think, with the government rolling out programs such as the nets that are being rolled out in the different counties, the indoor residual sprays that have been that are being distributed, the malaria vaccine which continues to be implemented in the different counties and countries, neighboring countries as well, because you have to deal with the problem not just within those counties but also the neighboring countries as well. I think there has been significant progress. One of the biggest things that we are doing and we are contributing towards is the education and the advocacy for behavior change. I mean, with that, I think we will counter so much more in fighting this as a collective. When we galvanize with the tools, the resources that we have, we're able to, galvanize and coalesce different people to come together to see what are some of the financial gaps, where can partners come in to support each other. I think one of the biggest challenges has been, this fight has been very uncoordinated, so different arms doing different things, so there's often overlap, people doing the same thing. But I think just having this one umbrella, this campaign that is being meted in 2 tranches. One is the national campaign where we're creating this awareness, and 2 is we're having county-specific campaigns where we're rolling out information, communication, and education materials to fight malaria in the different languages in those counties. And we're starting with 3 key counties in Kenya, Kakamega, Kilifi, and Kisumu. So there's been a lot of workshops, a lot of trainings, bringing together whether it's community health promoters, community members, through the barazas, bringing the youth. Just so you know, there is also a malaria youth army. There is the president's task force across the African countries that's fighting this. So I feel like all these different facets will help us fight malaria.
Well, that concerted approach, as we mentioned, and I know earlier on you mentioned about the challenges, be it political and equally in terms of civic education, but kindly clarify in terms of the challenges that we are facing in terms of fighting malaria in the country, because there are significant threats to malaria control and prevention that risks slowing down the progress that has been made so far. Yeah,
I mean, just people understanding just because they're not in the endemic counties, it will affect them in one way or the other. And this, for countries like ours that have fragile health systems, it puts a further strain into our health systems countering this. Malaria is one of the biggest causes of work absenteeism. Malaria is also the biggest cause of, children missing school. So this, when you put all these things together, they have a huge economic impact. I think one of the things that the pandemic showed us is health is wealth, like quite literally. And we need to bring these conversations around health and well-being to the forefront. I wish health actually made the top news, the top 3-4 news instead of politics. Because we just realized without health, the whole country, the whole economies can be brought down to their knees. So that's one of the biggest challenges. People figuring out and understanding everybody has a power, and that's why our campaign is called The Power of Everyone, what everyone can do to contribute to this fight. Number 2, climate change. The climate crisis has been really impacting health in more ways than one. I think for the very first time in all the climate conversations, last year in COP29, we had a day dedicated for purely health. And one of the things that the WHO Director General even said was, the face of the climate crisis is health. The impacts, the disparities that are there is, health is really the face of the climate crisis, because we're seeing the significant impacts it has. The other challenge has been the financing gaps. And, sometimes I know our governments and different development partners face challenges in trying to determine just exactly the same challenges that households face, trying to prioritize all these disease burdens. Which one do we prioritize? Which ones don't we prioritize? Everything is important, but then there are urgent things. When COVID came up, COVID became top priority. Everything else was below that. So those are some of the significant challenges, and just even education, people understanding that I have the power to help myself and help my community to fight this malaria. If people just understand and educate themselves, and how we can use these online campaigns to support offline activities and initiatives will really go a long way. But those are some of the significant challenges that we are facing: climate, financing gaps, political will in some areas, the priorities, how are we able to prioritize the urgent, important, etc.
And there are solutions on the table.
There are solutions. One of them